and welcome to Newsmakers. I'm your host today, Carrie Coogan, and we are here talking health issues with Kansas State Senator Molly Baumgardner. Thanks for being here today. And we're also here at the beautiful museum at Prairie Fire in Johnson County. Have you been here before?
I have been here before. It's quite wonderful.
Beautiful complex out here.
It is.
So you wanted to talk health issues today, and specifically mental health issues. Why is this a passion for you?
Well, as an instructor and just through my career, I have just known so many families and students that have mental health issues, either personally or in their families. And what most people don't realize is just how prevalent mental health issues are. In fact, we have 1 in 4 adults that are treated for mental illnesses in any given year. And I guess what's really more surprising is that when we think about children, so age 8 to 17, 1 out of 5 of them is diagnosed with a severe mental disorder. And so we have lots of folks that have this illness, and they do need treatment for that.
So is the concern that there's a lack of awareness about this in the state, or is there a concern that they're not being treated or diagnosed? What are the issues?
Well, right now, at least particularly in my Senate district, there's a lot of concern because Osawatomie State Hospital is in my, many of the employees there live in my district, and actually the hospital is just outside of my district. But in the springtime, the organization is the Centers for Medicare and Medicaid came in and inspected the hospital, and they said that there were some major changes that needed to be made on the facility. So we had to cut the patient load by about 40% to get ready for that major renovation. And so
what happened to those patients?
Well, some of them were there, and actually their treatment was over, and yet there wasn't a place for them to move into. Families did not want them moving in with the families, and so part of the work that was done by the staff was to find a location for them. So there was tremendous concern, of course, that would we be able to, in the 5-month span until October when the renovation is over, would we be able to meet the very severe needs in case there was a mental crisis for patients. And so there's been a lot of work. Our governor and the legislators did approve that more than $3 million was going to be available for patients that were in need, if we were at capacity, could get that treatment.
And so is the hope that this, when will the facility be back open, and is there going to be a push for more awareness in the state? Because you're right, those numbers are startling.
They are startling. What's going to happen is we are still at about 60% capacity. So we'll be able to increase the number of patients that we can have. There have been some it's difficult to imagine that there are positives from this, but there were some concerns because our employees at the state hospital were working lots of overtime, and so that's dropped down by 75%, which is wonderful. The 30-day return rate of patients has dropped down considerably, so that's a good thing. What we found is our community mental health centers have really stepped up and helped out in ways that they haven't before. So I think what will happen is we'll have more capacity, which will be a good thing, but we have a better network as far as within the different counties and communities as far as what facilities are available for folks. And I think that anytime there's more conversation and people are able to express their concern, I think that that's good. It really heightens that awareness.
Awareness for everyone, whether they suffer or know someone who suffers from mental illness or not.
Absolutely.
Well, unfortunately, we're out of time for today, but thank you so much for coming in today.
It's my pleasure.
And that's all the time we have here on Newsmakers, but we'll see you right back here again next time.